Hi there. If you have a baby or if you are currently expecting, then this video is for you. So today we are talking about new developments in the world of RSV immunizations. Previously, you weren't able to get anything that would help protect your baby against RSV unless they were in a very high risk category. Over the summer, there were some great approvals that allow more babies to be able to get this immunization and protect from RSV, which we know we are in the middle of RSV season. Hi, my name is Megan Clanahan. I am the co-owner of Houston Moms, and today we are bringing you another informative health video and timely video for you from our friends and partners at UTMB Health. You've seen Dr. Murray before with us, and as we've talked back to school immunizations and even back in the day and COVID and all of that. Dr. Murray is rejoining us today. Thank you so much for being with us.
No, thank you for having me. It's a pleasure to be here.
Absolutely. So can you give a little bit of a background for yourself?
Absolutely. So my name is Manuela Murray. I am a pediatrician, a general pediatrician, and I am also the director for ambulatory practices for the Department of Pediatrics at UTMB.
Perfect. And you're a mom of two.
Also one of it. Yes, a mother of three. I have well, she's going to be 17 tomorrow, and then a couple of twin girls that are 14 years old.
I forgot you had twins too.
Yeah.
Most people have probably heard me say this, but I have boy-girl twins that are 13. And yeah, I just got my girls' Christmas wish list yesterday. So these teen years are very special.
Yes.
They want all the things that I want too, right?
Right. Yeah.
Like, okay, well then maybe it can work out. So it seems like a million years ago, a little bit that I was pregnant with twins and high risk and all of that. And you were reminding me earlier about Synagis and what that used to be for babies. And so can you kind of talk about the new developments that are happening in the pediatric immunization world as it relates to RSV and to all of our expectant and babies with mamas out there?
Absolutely. So let's start by talking a little bit about what RSV even is, because you know, 3 letters, and to some people they exactly know what it is, especially if they ever have had an infant that had it and that got really sick with it, they do remember. But some people, especially like first-time moms, they have no idea what that is. So RSV stands for respiratory syncytial virus. That's just a big word. And it's just one of the viruses that are out there and that get higher during respiratory season. It has been with us ever since I remember going to medical school and doing my pediatric training. We have had RSV around. It's not anything new. And if you or I get it, we might just get a common cold, and that's it, end of the story. But for little babies, especially babies under 6 months, and for babies that are high risk, either because they're premature or because they have heart conditions or lung conditions that put them at higher risk, or for babies in populations that have a little bit more difficulty getting access to care, can also get a little more complicated. It can make them can make them really sick. It can help affect their oxygen level, and it can make them get dehydrated, and it can also lead to complications like ear infections and pneumonias and things that are more severe. And so we're super excited in the pediatric world because up until now, RSV is that one illness that makes babies really sick, and we have absolutely nothing. We have had nothing to treat it with. If you come to see me for RSV, what I am going to do is I'm going to make sure your oxygen level is okay. I'm going to make sure you're hydrated. I'm going to send you home if that's the case, or if it's not, then I'm going to have to put you in the hospital so we can give you some oxygen, give you some IV fluids, and really just hold your hand through it. There is no effective medication. Usually albuterol, which is the nebulized treatments that we use for kids that have asthma, they don't work for RSV most of the times. And so we're extremely excited because this is the very first time that we have something to help us prevent those bad outcomes in babies. And it's the first time that we can tell the parents of young infants that yes, we can prevent these. So like you said, this summer it was approved for babies, for all babies that are 0 to 8 months, to get a one-time shot that they can get as early as when they are in the hospital after being born. And it protects them for the full season. So it gives them protection for about 5 to 6 months. Usually RSV season, depending on where in the country you are, it starts around like October and ends around February or March. And so, and really babies that are older than 8 months, as long as they're healthy babies that don't have any high risk factors, they should do pretty well with RSV for the most part of the time. They can still get a high fever and things like that, but they're gonna handle it a little bit better than the really small infants. And so just one shot can really give the child the protection that they need to fight the RSV right when they encounter it.
That's so hopeful and exciting. And I know we have to be careful when we use words. And so why is it not appropriate to call this shot a vaccination? What is the distinction there?
So the difference is that this is a monoclonal antibody. And so when we give your body a vaccine, what we are doing is we are raising a flag for your immune system to go ahead and produce those antibodies. So think of antibodies as these little soldiers that we have in our body that are going to go and they're going to fight a specific disease. And so we are, with a vaccine, we're inducing your immune system to produce those antibodies themselves. With this shot, we're actually giving you the antibodies. So it works right away, because as soon as you get the shot, as soon as the antibodies are in your bloodstream, then you are going to have the protection that you need to fight the virus if you encounter it.
That's a great description. I've never heard it described exactly like that, but that, kind of sets the stage. So we're talking an immunization here for this RSV. We kind of talked about babies who are eligible. So, I mean, from you gave birth and you're in the hospital, like your baby is eligible. So I know we're just kind of starting the RSV season. We're November as of tape time here. Are we already seeing any sort of positive impacts from these from this new shot?
Well, so it's going to take a while to see the impact. It's not all pediatric clinics have it, not all hospitals have it. So it's been a slow rollout, but we expect once this is more of a universal practice and every baby gets it on any specific season, we expect a huge impact.
Okay. So if you are if you're pregnant right now, or you have a young child at home and you're just like, or a young baby at home, you're like, I've never heard of this. What should you do? Do you call your pediatrician and demand it, or what's the process?
Yeah, so it's, of course, it's because it's a shot for small babies. It will have to be given through the pediatric clinics. And so, yeah, definitely call your pediatrician and see if they have it available. Most insurances are covering it. Of course, that's something that you always want to check. And then if they do offer it, then go ahead and get it. At our institution at UTMB, we're starting to vaccinate some babies in the nursery already. So the ones that have already been born and are out there, we're catching them in our clinics. But our nursery this week is rolling out the immunization for the newborn. So we already have some babies going home that already have protection.
That's exciting. And I mean, if you're a new mom and you just given birth to this thing, this new thing that you're going to take out into the world, it's already scary. So I think one more thing that helps make it a little less scary to bring our babies home, especially in RSV season. So are there any side effects? So if I'm sitting here and I'm watching this video, my question goes to, what should I be concerned about? Like, what's on that pamphlet that they're going to give me of things I should be worried about?
So most babies have tolerated it very well. The most common side effects are going to be local at the site of the injection. So things like a little redness, swelling, a little bit of a sore muscle. Some babies develop like a little knot on the muscle with any injection that we give them, any vaccine. That's a possibility. It's rare, but it can give you a little bit of fever. The fever is more common with vaccines, where we're like making your immune system react than with these, but it can happen. Other than that, it's a pretty safe shot.
That's wonderful. So how soon, if the baby has a shot, how soon are they protected? Is there like a 24-hour window, 36 day of, what is that?
Yeah, it's pretty much immediate, because like I said, we are providing you with those antibodies. So it's just about the medication getting from your muscle through your bloodstream, which is a process that's actively happening as we're giving you the shot.
That's awesome. Like, I mean, that's pretty amazing if you think about it. And so we hadn't talked about this, but is there a maternal shot in my dreaming list that you can get? So how is this different, and how does that offer better protection or the same protection, or what do we need to know about that?
Yeah, so there is a vaccine that was also approved for moms that are pregnant, that are between 32 and 36 weeks of pregnancy. And the mother, that one is a vaccine. It's not a monoclonal antibody. The mother gets the vaccine. The mom's immune system produces the antibodies against the virus, and then they are transferred through the placenta to the baby. There are a couple caveats. The process of transferring the antibodies through the placenta takes a full 2 weeks. So if for some reason your baby is born early and it hasn't been 2 weeks since you got the shot, then the protection that the baby has is not maximized. The effectiveness of the maternal vaccine, it's about 50% to prevent hospitalization. The effectiveness of the monoclonal antibody that we give the babies, it's 75% to prevent hospitalization and 90% to prevent intensive care admission. So it's the numbers are pretty high. So the maternal vaccine, it's good. And I think that especially during this season, when we might have some shortages of one or the other, my recommendation will be get what you can get your hands on. Some protection is better than none, right? Later on, as things evolve and the availability of these products is better, then I will probably recommend the infant monoclonal antibody.
Okay, so if a mom is pregnant right now and she's in that window or is going to be in that window, can she get it and then the baby's born and they still get the immunization, or is it not recommended to do that?
It's not going to be harmful, but it's not recommended as necessary. So if the mom got the maternal vaccine, then it's probably not necessary for the baby to get the immunization or the monoclonal antibody, unless it's a very high risk baby. If it's a baby that's premature, less than say 29 weeks gestational age, or a baby that's has heart conditions, lung conditions, things like that, then in that case, the monoclonal antibody will be recommended regardless of mom's vaccination status. And also, if the baby is born a little early and it hasn't been 2 weeks since the mom got the vaccine, then they should get the monoclonal antibody.
Got it. I am so impressed, by the way, how that word just rolls off your tongue. Like, I can't even try to say that right now. I know we kind of went through that pretty quickly, but we wanted to make sure we gave the high points to our parents and those expecting and those who are new moms out there. Is there anything that you would like to add kind of to our discussion?
Yeah, just to know that it can be given during a well child check with any of the other vaccines that we routinely give during well child checks. It can be given with the flu vaccine. Babies become eligible for flu and COVID vaccine starting at 6 months. And so if we're seeing a 6-month-old, we will offer them their 6-month vaccines plus COVID plus flu plus the monoclonal antibody. And so it is safe to administer with other vaccines. And I don't think I have anything else. I think we've covered almost everything.
I think the really important distinction there is just, that it's an immunization. And I love that imagery you gave at the beginning. That helps my mom brain kind of process what that looks like. So we always appreciate your expertise, Dr. Murray. You are a wealth of information. So thank you.
Oh, it's my pleasure. I really love to get all this information out there. I like for people to make well-informed decisions about vaccines and immunizations and what to do for their children. So anytime.
Yeah, so that is a huge part of why we work with UTMB Health, is so that you can make informed decisions about your healthcare, that you have all of the resources there. We are going to drop a couple of links below in the comments, including an article that has recently come out from UTMB Health all about this RSV immunization and the season that we're in, and what to expect and all of the things we discussed in the video. As well as if you don't have a pediatrician that you know, love, and trust, and that you can have open conversations with, like you and I have had Dr. Murray, then we're going to also drop a link below about how you can find a physician in your area with UTMB Health. And we love them over there, and they are mainly in the Southeast. For all my Southeast, League City, Webster, Galveston, Bay Area people, that's who you should be seeing. So thank you again so much for your time, and we'll be back next month with another important health topic. But until then, stay safe, Houston, and enjoy your Thanksgiving weekend. Have a good one.